All right, I'm getting my third thing in whether you want to hear it or not. No, I know you want to hear it. Because the charity organization societies were a different idea about how you help families. They're basically what all of our quote-unquote clinical services came from. There was this idea of you had friendly visitors who were trained, and they went around the tenements rather than taking children out. They sat down with usually the mother, and they said, what's going on here, right? That idea of an assessment comes from the charity organization societies. A visitor who came into the family home comes from them. A clinical plan, what is it that they need? But it was, and it's grown to be the majority of what we do for families now, right? Family support is relatively small. This clinical, people have problems, we help them deal with their internal problems and understand better how to parent their children. That's the majority of what we do with kids and families now. That's the something better we feel like we have to offer. That's not just removing the child. So keep going. I'll see if I can get, I just put these up there because if you're interested in the history, there's all of these same ideas run through every era of time, right? We had the Charles Loring Brace is really, really interesting. He's the one who did Orphan Trains. Have you guys seen, there's a movie, there's a documentary on orphan trains. Those of you who are in digital media. It's really interesting. They basically said some of these children are so benighted, we would be doing them a favor to send them out to the Midwest and put them in a healthier circumstance. They took kids off street corners in New York and put them on trains going out to the Midwest. The train stopped at different farm towns along the way, and the farmers came out and they said, we want that one. She looks like a good worker. It's this kind of Anne of Green Gables almost, you know, that kind of mythology. There's this wonderful family, there's a great Aunt Em for you someplace, and with a really healthy house and lots of corn and butter and, you know, butter fat and all that, right? But what they were doing really was taking kids because they thought that if they removed them from, they didn't think they were doomed forever because they had bad parents, but they thought they had to remove them from their parents in order to give them a chance. So I don't need to go on any more about all of these.
I mean, how were the orphan trains, I mean, how did it all pan out?
Well, we're not doing it anymore. But it was a huge reform. I mean, it was considered, oh my God, this is so progressive. And Charles Loring Brace was like a god at the time. The Children's Aid Society still exists. It's one of the primary nonprofits in New York City. But it had all kinds of things because they were taking kids out of the city and into the country, and they were primarily taking Catholic kids and giving them to Protestant families. Because the Catholic Irish and Italian and other immigrants whose kids were being removed and sent out to work on farms. So you had all of these iterations of how do we try to help children. And it really wasn't until the Social Security Act in 1935 that we had any systematic provision of, at the federal level, of government provision for kids and families. So keep going. But 62 is where John Myers says that's the cutoff point, because that's really when you start to get a scientific base for this. It wasn't then just, you know, I believe these families can help themselves, can pull themselves up by their bootstraps. No, I think that I can tell the difference between a mother who's never going to be a good mother and one who could be, right? This was science. It was X-rays, and it was basically the battered child syndrome was Henry Kemp and his colleagues in Denver at Children's Hospital in Denver noticed a certain kind of fracture. And they took X-rays of them, and then they said, published in the medical, you know, journals and stuff, if you see these kinds of fractures, these kinds of injuries, they would not have been achieved by accident. Somebody has been applying pressure. And that really swept a lot of people along because it was science, because it was doctors. It wasn't just, you know, soft-hearted people going, okay, I know what's going on here. And so they, pretty soon after the battered child syndrome, you started to see states around the country establish their own presence in terms of child protective services, and then you start to get some amendments to the Social Security Act. So by 1975, 74, we finally got where Daniel wanted me to start. Basically, with the first money to help states provide services and supports, bless you, came through the Social Security Act. It was CAPTA, but it was the first money that went to the states to say, okay, when you recognize these situations, now you know from a medical standpoint how to recognize them. What are you going to do about it? Then you have like a stronger moral obligation to do something about it, right? If you have scientific proof that somebody's been abusing their children. And this is by no means the entire list of all the policies that have been passed, but it just gives you an idea that this is an issue that's been around for forever. And almost every generation has a somewhat different kind of social consensus on what we should do about it. But every social consensus is fragile, because it actually is a set of really complicated problems. It's not a simple, it's not a simple solution, and it's not only one problem. It's the combination of poverty and social circumstance, and as you said, cultural differences and family stress and social isolation and all kinds of things that contribute to people coming to the attention of the government for maltreating or neglecting their children. So as I said, the first iteration of CAPTA was 74. It was, now that we've recognized that child abuse really does exist, somebody's got to do something about it. And it's the states that should do something about it, the states and the localities, not the federal government, it's the localities that should do something about it.
Just on CAPTA, maybe it's good to note, after Kemp, of course, Kemp's battered child syndrome, that was like this big blockbuster that got around, but, CAPTA then comes out of that work and also this kind of flurry of media coverage. So,
yes, right.
So, I think it's kind of important for us to kind of think about those opportunities and how okay, if his story was just in a if his study
If he was
just,
the only person, right, exactly.
then it just,
Right.
And the policy was in reaction
Right.
to that.
So once it got validated, by Denver Children's Hospital, right, an upstanding institution, other pediatricians started to say and publish their findings, right, and say, we're seeing it here too. It's not just an anomaly that happened it was largely physical abuse, because that was what could be documented in this way, right? And then once you say it's real, it does happen, children do get abused, then part of the reaction was, and if you know anybody who should be abused, who was abused, you should report them. So almost every state by the end of the 70s had child abuse reporting laws. So then you get child abuse reporting laws, then you really gotta do something about it, right? Because you've told the public they have to call if they see anything that's wrong in families, right? So you can't have a whole set of calls, 1,000 calls, and you say, thank you very much. So then at the federal level, they said, okay, then we'll provide some resources to the states to start to set up some services that will enable you to do something. Because the easiest thing to do was report. Let's report. And really within about 5 years, every state had said, okay, we should report. All right, now, what are we gonna do with all those reports? What are we gonna do about it? Then the next big thing that came along was the Indian Child Welfare Act. We finally call it ICWA. But the reason it's a really big deal is that one of the few privileges that, we subdued all of these Indian tribes all over the country, right? And what we did was we agreed with them that they had sovereign nation status. But we didn't give them any powers of a sovereign nation. We we gave them, if you're, reservation tribe, they had a certain amount of land, but it was just as much a feeling you're being sequestered on a certain amount of land as it was that isn't this wonderful, you have your own land, right? It's really only recently, since we're allowing casinos and stuff, that there's an obvious, financial advantage to being an official member of a tribe. But one of the things they did have as sovereign nations was jurisdiction over their children. So that came up very early on, that when a child is a member of an American Indian tribe, that the tribe should have first say-so about what's gonna happen to that child. If that child is not safe with their parents, then the tribe should decide where they should be placed, not the state, the tribe. It's still very defended, very, very, very important power to a lot of Indian tribes because, for obvious reasons, right? Their future, the next generation, et cetera, and it's one of the few things that sort of really marks their sovereign status. You have to treat us differently than you would treat another set of families. Then in the 80s, really, so 1980, yeah.
Now, with the Indian Child Welfare Act, a huge problem I've noticed is the diabetes and the overeating, the introduction of processed food. Couldn't that be considered maltreatment then?
There's a big issue about this, you're absolutely right, not just with American Indians, but in general. There's a number of cases of people reporting obesity to child abuse hotlines. So we were talking about, I can't remember whether it was your class or the other class, right, when somebody who was a caseworker was talking about she had just been out on a call. So the call comes to the hotline, they do an initial assessment, right, it's given to somebody for an investigation, right? She had been given an obesity case for investigation, and she's like, and what am I supposed to do, right? I go out to the home, I counsel the parent, I counsel the kid. I think one of them was like, she was a 17-year-old child, right?
I don't remember.
Sort of, it may have been in the other class, but this is a 17-year-old who we're alleging is being abused because her parents are not making her take her insulin and change her diet. Well, she refuses to take her insulin and change her diet. So, child welfare, what are they supposed to do? But yeah, there's a lot of concern about that. As I say, not just with American Indians, that is now an increasing sort of instance of people saying, let's use child abuse reporting laws to stop something that's obvious. It is bad, right? But what are we supposed to do?
In our Meyer reading before 1978, they said a lot of Native American children were taken out of their families. Was that for like assimilation's sake, and how did
Well,
they go about it?
it's the same thing, like now we have several populations still, we call this disproportionality issue, right? A much higher number of African American children are taken from their families and still American Indian. But
And soon to be Latino.
and soon to be Latino, what's happening with Latinos is that as the population of Latinos grows, right, the child abuse rates are catching up with that.
Yeah, generation upon generation. All the protective factors of first generation seem to be disintegrating. So, you come to America there's a certain other mitigating factors, but it's interesting. This
Yeah, it's
poverty in
very
America has a.
It looks different than it does in Mexico or South America, for example. More family-oriented culture, more assumption that we're gonna, we may not have everything, but we're gonna share what we've got with our family members, right? And then you come to this culture where it's like, everybody for themselves. Besides that, you have to work 3 jobs in order to even feed anybody. It's all of those kinds of factors. But we haven't yet gotten to, they just haven't quite caught up yet with the other group, Latinos.
Yeah,
In terms of,
but
right.
2000, the AFCARS had the big national clearinghouse of data had. It was 10 states with an overrepresentation of Latinos versus their population and the general population. By 2006, there were 19. That's Alan Detlef's research, really interesting
Right.
stuff. And then also in California, it was 1/3 of the general population was Latino in 2000 census, 1/4 of the foster care population,
now it's half and half. So
And
you
what-
see we're.
Right, and what we've seen here is 10 years ago, the Latino families were more likely to be in ER. They were investigated, but often not, children were not removed. But now you're starting to see more children who are actually removed and in foster care. Sort of, it takes a while to catch up with these cultural norms and for the system to catch up.
This is kind of on topic, kind of off, just kind of on the theme of people coming into these homes and kind of being a part of these stories. And I don't know if you're familiar with the story, although I'm fairly certain you are, just because of like, you've been in this industry or like sector of the government for so long. But the story where two journalists were basically watching the maltreatment of children over a period of a year, to the terms of like, the parent had AIDS and was brushing his teeth, and then the journalist watched the kid use the same toothbrush, or like, and they didn't do anything over the process of a year, so that they could do the story from an outside, and then something was done afterwards. What is your perspective on that story? Like, if you're on the media side, if going into these stories and not touching it is like what you should do, or alerting more like government agencies, or what media should do to let more people know about why there's all of these policy changes and things like that?
I'll give you my opinion and Daniel can give you his. Well, I don't know that we'll try to do it differently, but there's an idea called a mandated reporter. And it basically is that if you're a professional who has something to do with children, you have an obligation to that child. Your first obligation is to that child. You are required to report if you see something that makes you think that children are being abused or neglected. And so we go back and forth on who should be included in that, right? And every time there's a, and I don't know this story in particular, but every time there's a big story, like in particular the LA Unified one with the teacher who was putting semen on the cookies, right? I mean, stuff like that. There's stuff like that, and people say everybody has to be a mandated reporter, right? We have to expand that, because how could other teachers, how could principals in that school, how could parents who knew something was going on in that classroom but weren't listened to, how was it that they were not listened to, right? We should expand it to everybody. And then, there's the other point of view. I don't think it's a situation, but the other point of view, which is, but if my professional responsibility is to tell the story, right? So me, I'm gonna err on the side of everybody who thinks they see children being mistreated should be reporting it. They don't have to themselves say, I'm taking your child home with me because I don't like how you're, dealing with them. But to me, they should be at least calling and saying, there's something really wrong in this house. But
Well, I think, we're clearly a little different. It was interesting, like, Berkeley, we had a class, same class, but it was on Tuesday, so the night before last. And we could start talking about like when, it was something we're gonna talk about later, but this question of when do you disclose the name of a child, or all these different questions about reporting on these things.
Right.
And my standard, and I think it should be the standard for all journalists covering children, vulnerable children, and children who have been abused and neglected above all, is best interest of the child, just like you do in a legal setting. So if I know that this kid is going to potentially contract HIV by virtue of brushing their teeth, it is my responsibility as a journalist to forget about me trying to get a great story and trying to fix that situation. And there's probably a million stories you can write about that. So, in terms of that, I think that there's a certain ethical, and we're gonna talk about that a little bit later in class also, but there's an ethical standard that needs to be there.
So we get something, just to give you an idea, in our county, we get something like 150,000 calls a year. There's probably 60,000 investigations, more intensive investigations. 40,000 cases open. I'm not remembering the numbers exactly offhand, but at every stage of the process, it goes way down. So this idea of, okay, so now we should have 300,000 calls here.
And the people who are
we're
answering
gonna-
them and going out to deal with them,
Right,
you
and
can't
then,
get to all
and then
of
we're
them.
requiring when you have to get to them, and you have to get to them within a certain time frame, and, right, and you still know that not all of them are gonna be found to be actually abuse and neglect, right? It is hard, but you understand the imperative when you read one of these, I mean, the Catholic Church, right? The Boy Scouts, the Sandusky, where they've had a lot of them recently, where even though we've had these reporting requirements for a long time, clearly there was institutional collusion or interpersonal collusion of saying, oh no, that I can't get involved in that. Just go. But by and large, there's an immediate response or there's a longer response. Immediate response is basically within 2 days, and longer is 5 days to a week. So there has to be a quick response, because there's no point having calls if you wait for a month and come out and say, I understand that you're not treating your children well, right? But it's a huge management issue, because there's so many. And there's also a process for basically screening out, and you're gonna hear more about this, right? Because there's a lot of things that come in that are just clearly not abuse or neglect. There are people who just don't know who else to call.
Jesus,
But-
if you go look at, I mean, what's crazy is if you look at like these rosters, so a reporter, this is very good, you know, thinking about covering this stuff, but a reporter will go and say, oh my God, you know, this child had a, you know, serious case of maltreatment or died, okay? And CPS knew about this child for
Yeah.
so long. Well, really, if you look back at the records, it's a divorce or it's a domestic, like, dispute situation, or some family member calling on this family, okay, and so this somehow, and how is the death counted and whatever else, so you can see these long records where there's a lot of erroneous calls coming in anyway, so it's kind of,
And
which is
then-
something nobody ever thinks
And then
about.
there are other cases where there are a lot of calls and people didn't pay enough attention.
Yeah,
Right, I mean, it happens both, there are mistakes on either side. It's, even if you have a standardized assessment tool that's been validated up the kazoo, right, there's still judgment involved. And people, you know, not paying attention and not knowing what they're looking at and not knowing what they're looking for, absolutely mistakes happen. But there's also there's a lot of child custody cases where the aggrieved parent is calling all the time, or the aggrieved grandparents are calling all the time saying, I know that she's mistreating that child. Anything else? Sorry.
During most of the presentation, we were talking about how the focus in legislation was on rescuing children, and like we can see throughout history, we have all these pieces of legislation that come out, and it's mostly about like saving a kid after a situation's already happening. Do you see policymakers moving in a different direction moving forward?
So it's,
Maybe to be proactive instead of reactive?
these are almost always reactive, and you can tell in the Myers piece, right? This gets identified, so, all right, let's pass a law against that. Or we discover that we're putting too many kids in foster care and we just keep them there, right? So we go, oh my goodness, let's put timeframes on it, right? Oh, now we've validated that there's a high percentage of sexual abuse cases, we need specific, right? It's because it's one of these emotionally charged issues, you never want to be the mayor or the board of supervisors member or the city council people who were, or the school board superintendent who were in charge when a lot of children were abused, right? First of all, you will not get reelected. Second, it's just like, oh my gosh, I didn't do it, but I'm like landed with it. It's very hard not to be reactive if you're in those situations, to say, this will never happen on my watch again, right? But because it's such a complicated set of factors, no two cases are ever the same. That no two cases are ever the same. So taking the policy solution, every time there's a bad case, we're gonna pass another law. There can be another way of having a bad case, right? So the reaction makes perfect sense, and probably some of it is extremely useful. But how do you get to basically solving society's problems in a policy way? So yes, I think there's I don't know if they're policymakers who are so interested in this idea of prevention, but there's a lot of people in the advocacy world and in the science world who are really interested in prevention. What would we do in order to have a chance of preventing these things before they happen? And the whole question of what really is promotion of wellness, right? So now we talk about this continuum of promotion, health promotion, prevention of bad things happening, intervention once bad things have happened, and intensive intervention to prevent other bad things, right? It's a much more sort of, as you guys are kind of implying, the mindset, at least in some jurisdictions, is moving much more to what would prevent. But it's really, I will get to your question, I promise, but I'll forget if I don't say this. We don't have many entitlements in this country anymore. And one of the few things, you're entitled to a public education, free public education, and you're entitled to child welfare, entitled to child protective services. Your child is entitled to be in foster care. You're not entitled to welfare payments anymore, you're not entitled to income support, you're not entitled to food stamps, you're not entitled to health care. You're entitled for your child to be in foster. The reason I say it that way is everything that goes wrong in societies when children are involved comes to the door of child welfare as a last resort. When nobody else will do anything, call the child abuse hotline and say, this child isn't safe. There's something really bad going on there. What that means is it's unlike a lot of other service areas where, you know, if you're at a hospital, you're gonna get people who have a certain range of things that happen to them. Everything comes to child welfare, and my favorite example of that is I was doing interviews of workers all over the county here, is the worker in the Antelope Valley who said he got a call because the horses were shitting too close to the well. So this child is being abused because their water supply is being contaminated. So it got through the hotline, he had to go out and investigate. He's like, I had to call some agricultural people. I mean, I don't know what the distance is from, I mean, I don't know from wells versus, you know, but I'm supposed to like figure out whether the fence is in the wrong place so that the horse isn't gonna get too close to the, and there's this, often that whatever that first presenting thing is not, once you get there, you see a lot of other things. But it's everything from the horses shitting too close to the well, to they're not giving them, we're not making them brush their teeth, to that child is too fat, to they're screaming coming next door from the house next door, to I actually have seen this child and there's, you know, welts and bruises on their arms or legs. It's everything. And so it's really difficult to figure out what a policy would be that could prevent anything bad from ever happening to any child. So what we've been doing in LA County is we got our Department of Children and Family Services to identify $5 million on an annual basis. Their budget is $1.8 billion. $5 million is a drop in the bucket for a prevention initiative. And their prevention networks in each of the 8 service planning areas or SPAs. And those prevention networks have 3 things they have to do. One is decrease social isolation. 2 is increase family economics, self-sufficiency. And 3 is ensure access to all the services that are already there. And they have to do it not just for families who have open cases with the department, but they have to do it with people, basically primary, secondary, and tertiary prevention. At least 50% of their money should go for families who have never touched the Department of Children and Family Services, in hopes that they never will. And then the rest of the money is divided between the families who have a call to the hotline but nothing else has happened, and those who perhaps have an open case but may have been in foster care a long time, youth who've been in foster care a long time. We provide a range of prevention services that's for everybody. We don't say you're a kid who's been in foster care a long time, we're only gonna give you counseling because we know you must be really screwy, we're still gonna work on those same things, access to all the services that are already there, and chances to increase your ability to support yourself, and decreasing social isolation. So there's a lot of group and community organizing kinds of projects, there's school tutoring, GEDs, just all kinds of things in different parts of the county, and we've done a pretty intensive evaluation, and it's really promising. The results are really promising. It's one of the more promising prevention projects around the country, because a lot of the research that's done on prevention hasn't shown much impact. So
This is called, it's called?
it's called the Prevention Initiative Demonstration Project, PIDP. That's a typical government kind of a name that you think. And we've got, I think, 3 articles out now on the results, but it's really exciting what's going on in a lot of places.
I'm just curious to back up really quickly. You said they're using 50% of their 5 million towards families that have never been part of DCFS. Are they choosing them based on their like communities?
Right, so it's $5 million spread amongst the 8 spas or service planning areas, right? It's a really small amount of money. They have a lot of latitude as to what they do, but for example, in Spa 6, which is South LA, right? They set up 4 family resource centers, and they're basically places where anybody can come who has questions or needs something.
Oh.
So they're referred by local churches or local agencies, but it's also people just walking in off the street saying, I need some help. They're in 4 places. One is a church, one is like a mini mall, one is an agency, et cetera, right? And they've got all of these resources, and you can computerize, right? And you can come in and just look stuff up. But they also have what they call navigators. So you can sit down with somebody who will say, okay, so tell me what else. And because most people come in saying, I can't make rent, or I need food, or what, but there's a lot more behind that. So they're not picking per se, they're doing outreach and people are coming in. But Department of Children and Family Services is referring, particularly the families who, they investigate, but they're not gonna open a case. They say, we don't think there was anything going on here, however, it does seem like you have some issues, and if you would like some help, let us tell you where you can go if you wanna find it. So it's much more voluntary, it's not, and that's particularly the group where we've had the best results. Only about, for an 18-month period of those families who were referred through ER, only 12% of them had new referrals to the department versus a randomly selected comparison group, twice as many had re-referrals, so 12% versus 24% of ER cases who are referred, and they're, it's completely up to them whether they go in or not. It's not.
What is the prevention initiative doing to decrease social isolation?
So there's a lot of work, group work basically, and there's 8 different entities, so they all do it differently, right? There's a lot of focus on, one model they use is called Neighborhood Action Network, Neighborhood Action Councils, NACs. And so they go to key agencies or parents groups around schools or local communities and say basically, what do you all care enough about that you'd like to work on doing something about? It really, in particular, works really well. Parents around the school are concerned about, school crossings or whatever it is. So that's one model used a lot, particularly it's called relationship-based community organizing. And it's relationship-based because it's not like, we all care about school safety, so everyone who cares about school safety, come to my house and we're gonna talk about it. It is, what do you care enough about that you'd be willing to work with your neighbors together on? Or there are things like the affinity groups, young fathers, teen fathers in this community who all wanna learn how to be better fathers, right? Or there are, other kinds of parent groups around certain topics, there's this great agency that does arts for abused children, you know, so they gather people together to do arts projects with their children. There's just a whole lot of things, some more specific and bounded and some broader.
And in terms of prevention, I mean, we have a public education system that's very inequitable, and so the majority of schools, well, many schools are socioeconomically isolated, and so the children don't receive the same level of education, the same level of social service. And so, I mean, it's only natural that when they graduate, if they don't have the same skill set, they're not going to be able to find jobs, and they're going to continue in a cycle of poverty and potentially become, you know, tomorrow's perpetrator. And so I don't understand how, like, the discussion of prevention cannot include the inequitable education system that we're working within, because I think that that has a lot to do with the problem.
Yeah, absolutely. The basic dilemma of working in the prevention area, there's a lot of them. How do I count the ways? One of them is, what are we preventing, right? And one of the basic dilemmas is, who's gonna pay to prevent any of it, right? So child welfare, it literally took us very strong advocacy 4 years to get this money set aside. It's child welfare system money, and so there had to be a strong hook to, right? It would be a completely different sort of argument and probably plan around education, around early childhood, around healthcare, et cetera, right? It's where the resources, and how do you free up even a small sliver of resources to demonstrate that prevention can be effective. And then the third big problem is prevention, you don't see it right away. It's hard to measure, right? And you don't see it right away. Usually what you're doing is you're intervening early and somebody else is gonna reap the benefit, right? So we have all of this research about early childhood education and how effective that is in preventing all kinds of things. But who it's gonna save money for is the high schools, the prisons, the welfare system, who are unlikely to put up the money from their current budgets to take their resources and invest it in another kind of institution. So, yeah, you're absolutely right. There's all
Well,
kinds
well.
of prevention things that should and could, and sometimes are happening. It makes perfect sense to us, right? I mean, as citizens, as parents, as whatever, it makes perfect sense. Would you rather prevent or would you rather treat? But the institutions have a vested interest in their own slice, their own, we call them silos, their own silo.
And it makes me wonder how much the institution really does want to strengthen the family.
Oh, right.
And
But if
Right.
you're a jail, you don't want to strengthen the family.
Right,
Right,
Right.
exactly.
Got a
Exactly.
disincentive, I mean,
right,
you know, so you gotta fight all those forces too.
right. And even the school, there are plenty of schools that really don't want to strengthen families either,
Oh,
right?
absolutely not, yeah.
Hopefully you've gotten the point. It's a very challenging set of problems. It's not one problem. It's a very challenging set of problems. And from the beginning, nobody has really known, how can you resolve everybody's problem? There's no single answer. And so the controversies in the field come because people have very different perspectives on what's really the issue here. And we have these tensions, and we sometimes talk about it as the pendulum swinging, right? So now we're all very focused on the danger of coaches, right? Or the dangers of priests, or the dangers of Boy Scout troop leaders, right? That the reaction to authority figures who deal with kids has changed the way that we view that. Over time, as that sort of dies down, something else will come up and we'll say, no, we have this other, it's another thing that's really the problem. And these are these continuing sources of difficulty and tension. I haven't even really talked about the fact that you've got federal laws and a lot of federal money that goes into these systems. You have state laws and state money that goes into these systems. And at least in about half of our states, you have counties or sometimes cities. Usually it's counties, not cities. Local jurisdictions, and when you have 3 different sets of policymakers at 3 different levels of government making the policies, you are inevitably going to have collisions between what's important here and what's important in Washington or in Sacramento. You still have a lot of tension around what's the government supposed to do versus what are not-for-profit agencies supposed to do. What's the role of the not-for-profit agencies? And what's the role of government? Government's supposed to be equitable, right? May not be equitable, but it's supposed to be equitable. Private agencies may have an ability to care for subgroups better. They may be more sensitive to certain cultures or whatever, but it's not available to everybody. So how do you balance that out? The other thing I think I've talked about, but I just want to underline, 60% of our system is neglect. And not just here in LA, everywhere across the country. 60%. So when you're talking about that continuum of cases that are clearly abuse and clearly not abuse, 60% by definition is neglect. That's not clear. It's not physical abuse, it's not sexual abuse, it's not emotional abuse, it's neglect. It's the parents aren't doing what we think they should be doing. And it's approximately 20% physical and 11% sexual on average across the country. So when you talk about the child abuse system, you often have to remember to put in the words neglect, because most of the system is neglect. It's poverty, it's parents who don't know how to parent, it's people who don't know what to do with their kids, it's people who come in and look at somebody else's family and say, that's not right. You're not doing it the right way. It's all kinds of things. It's people, everything from, and it can be really severe. You know, children aren't being fed, but it's a whole different set of things than physical abuse. I think that's all I